Dr. Erlmeyer is my daughter, and so when we're in a professional setting, she calls me Judy. And sometimes I'll say, honey, you can call me Mom, so I think that she can call me Mom here. Dr. Erlmeyer is a pharmacist. She has worked in long-term care for a majority of her career and recently switched roles to a specialty pharmacist. And so her topic today is about a specialty med, and I'll let Megan tell you more about her background, and maybe you can do that while I'm pulling up your slides.
Can I use this when I do this, or what's this difference between these?
I think that this is picking up what he's filming, so I think you
Okay.
can just leave that there.
Okay.
Okay. Sorry.
Yes, so as Judy said, I've actually worked in many settings, long-term care, retail, inpatient. I've been at long-term care for a while, but about a year ago I transitioned to specialty pharmacy, and I mainly, my main disease states are oncology, PCSK9s, and a little bit of migraine. So today I'm going to be talking about PCSK9 inhibitors. And our objectives for today are to list the FDA-approved medications within the PCSK9 drug class, discuss the benefits of the class of drugs known as PCSK9 inhibitors, and discuss specialty pharmacy workflow for dispensing PCSK9 inhibitors. So the two medications that we're going to talk about today are Repatha and Praluent. These agents are human monoclonal antibodies or immune system proteins created in a lab. We're not going to go too much into indications, but what I want you to kind of notice here is that these medications are used to treat high cholesterol. The other indications are myocardial infarction, stroke prophylaxis, and then Praluent also has an indication for unstable angina. A couple other things I wanted to point out here is that Repatha is approved for children over the age of 10 and adults, where Praluent is only approved for adults. And then the other thing that I'll mention again later is that both medications are injections, and that Praluent is recommended for patients with a latex allergy. Okay, so elevated LDL, which is part of your cholesterol, contributes to heart disease. So we're going to kind of start with a big picture and talk about ways to treat high cholesterol. And so when you treat cholesterol, you have modifiable risk factors and non-modifiable risk factors. And this is for heart disease, and there's modifiable and non-modifiable risk factors for other disease states as well. So our modifiable risk factors are things that we can do ourselves to help lower cholesterol and then in turn help reduce your risk for heart disease. So one thing that we can talk to our patients about is if they are smokers to stop smoking, increase their physical activity, weight control, make sure that their diabetes is well controlled, that they have a good diet, and that they their alcohol intake is minimal. And then when we go to non-modifiable risk factors, these are things that we can't change ourselves. So one would be age, another would be gender, your genetics, and your race. So healthcare providers use lipid panels to help assess someone's cardiovascular health. And what you see in a lipid panel is your total cholesterol. You see your LDL, which is also known as your bad cholesterol, so that number you want to be lower. And you see your VLDL, and then your HDL, which is called your good cholesterol, and that's the number that you want to be higher. And then you also have your triglycerides. And then when we were talking about modifiable risk factors, your HDL, a way to increase that is to increase your physical activity. And then with your other points here in your lipid panel, working on those modifiable risk factors will help with these levels and then decrease your risk for heart disease. So since high cholesterol can be a contributor to heart disease, The fasting lipid panels are drawn to evaluate the patient's risk for heart disease. I'm going to jump ahead a couple slides here real quick to kind of put the next picture together for you. So elevated LDL, which we call our bad cholesterol, can lead to a buildup of plaque. And a buildup of plaque can lead to narrowing of arteries. Narrowing of arteries can lead to reduced or blocked blood flow, and then this can lead to a myocardial infarction. And so I'm going to pull up a little video to kind of give you an idea of what that looks like. Okay.
Meet Stephen. Some people struggle with lowering their LDL, also known as bad cholesterol, including Stephen. They eat well, take a statin for their cholesterol, but still aren't getting where they need to be. Many factors affect our LDL level. Some of these we can change, like diet, physical activity, and weight. Others we can't, like family history. And since high LDL has no symptoms, many people don't even know they have it. Sometimes our LDL levels can get too high even if we eat well, take a statin, and stay physically active. What gives? If LDL gets too high, it can build up in the walls of your arteries and form plaque and cause hardening of the arteries, also known as atherosclerosis, which can lead to heart or blood vessel problems. So how do our bodies control the amount of LDL in our blood? LDL receptors in our liver. These receptors help keep our LDL levels in check by helping the liver remove LDL from the bloodstream before returning to remove even more. Make sense? The story doesn't end there. The liver makes a protein called PCSK9 that is also involved in how much LDL is in our blood. PCSK9 attaches to the LDL receptors, telling the liver to get rid of the LDL receptor. However, this may cause a problem. Without enough receptors in the liver, our LDL numbers can get too high. But here's some good news. There's a medication that can limit the actions of PCSK9 and help dramatically lower cholesterol. Repatha is an injectable prescription medicine for adults with cardiovascular disease to reduce the risk of heart attack, stroke, and certain types of heart surgery. Repatha is also used along with diet alone or together with other cholesterol-lowering medicines in adults with high blood cholesterol levels called primary hyperlipidemia to reduce LDL or bad cholesterol. Do not take Repatha if you are allergic to evolocumab or to any of the ingredients in Repatha. Repatha works differently than a statin. Statins help to stop your liver from making as much cholesterol, including LDL. Plus, they increase the liver's ability to break down the cholesterol that's already in your blood. But for some, a statin may not be enough. When Repatha enters the liver, it keeps PCSK9 from breaking down too many LDL receptors. As a result, more receptors can return to remove additional LDL. And the more receptors you have, the lower your LDL cholesterol level will be. Repatha, in addition to a statin, helps people like Stephen who have heart disease drive LDL way down to reduce the risk of heart attack and stroke. Get on the path to dramatically lower LDL. Talk to your doctor about Repatha today.
Important safety information. Do not use Repatha if you are allergic to evolocumab or to any of the ingredients in Repatha. Before you start using Repatha, tell your healthcare provider about all your medical conditions, including if you are allergic to rubber or latex, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. The needle covers on the single-dose pre-filled syringes and the inside of the needle caps on the single-dose pre-filled SureClick auto-injectors contain dry natural rubber. The single-dose Pushtronic system, on-body infuser with pre-filled cartridge, is not made with natural rubber latex. Tell your healthcare provider or pharmacist about any prescription and over-the-counter medicines, vitamins, or herbal supplements you take. What are the possible side effects of Repatha? Repatha can cause serious side effects, including serious allergic reactions. Stop taking Repatha and call your healthcare provider or seek emergency help right away if you have any of these symptoms: trouble breathing or swallowing, raised bumps, hives, rash or itching, swelling of the face, lips, tongue, throat, or arms. The most common side effects of Repatha include runny nose, sore throat, symptoms of the common cold, flu or flu-like symptoms, back pain, high blood sugar levels, diabetes, and redness, pain, or bruising at the injection site. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Repatha. Ask your healthcare provider or pharmacist for more information. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information.
Ask your doctor if Repatha is right for you.
So the PCSK9 inhibitors enhance removal of the LDL to help prevent myocardial infarction or heart attack. The patient population that I see, some are on statins, but their LDL is still elevated, so they add a PCSK9. And then another chunk of the population that I see are patients that have a symptom where they have muscle aches or muscle pains, which was kind of talked about at one of the presentations yesterday. And so that's when the PCSK9 is stopped, the statin is stopped, and then the patient goes on a PCSK9. So Repatha and Praluent are both injectable medications. They work really well, about 60% of lowering of your LDL or your bad cholesterol. And the other really good thing about this medication is that the adverse effects are next to none. The two I counsel my patients on would be injection site reaction, which goes along with any type of injection that you have a chance of having that reaction. And the other would be a postnasal drip, and that just has to do with what receptors the medication targets. And the good thing with the postnasal drip is that the majority of the patients, if they experience that, it's within the first month and it resolves in the first month. So they might have a little bit of a like a runny nose, and then it might have create a cough for them as well. And then the other good thing with this medication is that it has next to no drug interactions. So when you compare it to the statins, its efficacy and its adverse effects being low and its drug interactions being low, it makes it a really favorable medication. So the top left-hand corner, I have a picture of the Repatha, and then that is a pre-filled syringe, and then on the right we have the Repatha Prestonics, and then on the bottom there I have a picture of the Praluent, which is also a pre-filled syringe. So I'm mostly going to target the rest of our discussion on administering of the pens. So Repatha and Praluent are both administered either every 14 days or every 30 days. The other good thing with these medications is, say the patient is prescribed Repatha, and the normal dosing for that's 140 milligrams every other week, and Praluent 75 milligrams every other week. We get a prescription for Repatha every other week. The nice thing is that the patient can either do it every other week, so if they do their first injection on Tuesday, they'll just administer it every other Tuesday. Or another option is for them to take it on the 1st and the 15th of every month. So whichever way they'll remember the best is what I tell them, and I have them tell me what they're gonna do. If it's a once monthly dosing, it's the same thing. If they started on a Wednesday, they can take their first dose on Wednesday and then count 20 days after that, 28 days following, and that's when their next dose is due, or they could do it on the 10th of every month or the 15th of every month. So that's the other really good thing about the medication, is that there's some flexibility to help the patient remember to take their medication and with compliance. The other thing with these medications is that they have a 7-day window as far as counting it as a missed dose. So if I if I was due for my dose of Praluent yesterday and I forgot and I remember today, I can administer it today because it's within that 7-day window, and then I would just still fall back into my every other week dosing, or the same with if it's a monthly dosing, a 7-day window. So we as pharmacy personnel are in a place to provide our patients with as many resources as we can. So both Repatha and Praluent offer a coupon card, and I know for sure even that Repatha has a particular one-time use coupon card. Most of these medications, most of the Praluent and Repatha require a prior authorization from your insurance, and so Repatha for sure offers a one-time use card to be used while the PA is pending, so that's really nice. And then there is also grant funding out there, because as you guys, most of you know, the coupon cards are okay with commercial insurance, but not Medicare. So then when it comes to our Medicare patients and affordability, there are grants available, and one that I'm most familiar with is called the HealthWell grant. And that is something where for our patients that see our providers, we automatically set them up with that grant if they qualify. It is income-based. With our patients that we fill for but don't see our providers, the patient themselves or even the provider can go out and try and get the patient set up with the grant. I really like to direct patients to the websites as well. That second video I was trying to get for you guys is actually from the Repatha website. So those websites show how the medication works, and I think with some patients they don't understand why they're on the medication if they've never had a heart attack, or if they don't see that their cholesterol levels are elevated. It just kind of helps explain to them how the medication works. In simpler terms, another reason why I like the website is because they provide videos for administering the medication. They also provide, if the patient signs up through the website, they can get reminders, calendar reminders on when their next injection is due or when they should get a refill of their medication. They offer sharps containers to the patients at no charge as well. So that's why I really like to refer patients to the manufacturer websites when I talk to them. And then some other things that we can do ourselves as pharmacy personnel is depending on who you're working with for a patient. Sometimes I'll print out a calendar that says your dose is due on this day and this day. One patient I had come in for injection training, and I helped him use his smartphone to set up that we had given his injection a day and then for it to repeat every 2 weeks. So those are some things that we can do as a pharmacy to help our patients with success in their medication. So the other thing we want to make sure we do for our patient is set them up for success with their injections. So aside from needing their medication, we want to make sure that they have a way to dispose of the pen needle, because that's what has the needle in it. And so our patients, when they come in for their injection training, a lot of times we'll just provide them with a sharps container. Again, like I said, the websites, the Repatha and Praluent website, they can go in and register, and they'll get sharps containers sent to them. In Nebraska, we're able to use empty milk jugs or Gatorade bottles, so the patient can just put their pen in there, put the lid on the top, and then dispose of it in the trash. I know that not everyone's here from the same state, so if you get into the counseling with the patients along these lines, you just want to make sure that you know what your state laws are as far as disposing of needles. You also want to make sure that your patients have alcohol swabs. Here again, we provide, like every 6 months, we send out 6 alcohol swabs. We get decent reimbursement for these medications, so that's just something we do for our patients is we provide them with alcohol swabs. And then of course, their Band-Aids. And so what I'm going to do now is I'm going to just kind of point out a few points of the pen, and then I'm going to show you the injection training that I do. And my reason for incorporating that is, again, things that we've been talking about throughout the convention, is that technicians are able to immunize, and the hope is that down the road that this is maybe something that you guys will be able to do. And if not, you still have an understanding of what the process is if there's patients that call in and have questions, and it's something that you feel comfortable asking instead of passing it off. So starting at the top of the pin, you have your start button. You have your expiration date. That's always an important thing to look at. You have your medication window, which I'll show you how that works too, but we always want to make sure that the patient knows what it should look like. So when they're home giving their own administration, they know what to look for. And then there's also the medication window is important because there's a plunger that will display in that window when the medication's being administered. That little yellow piece is a safety device, and then you have your orange cap as well. Okay, so I brought a demo pen today, and our process at our pharmacy is that when a patient is to start Praluent or Repatha, we contact them and we offer in-person injection training. We also offer over-the-phone injection training, but in-person is generally the way that patients go unless they already administer medications for themselves or they have a spouse that is a nurse or provider, or if distance is a problem. But majority of our patients come in. And so I bring to the counseling room with me a demo pin, and the Praluent and the Repatha pins are just the same. And so I'm going to go ahead and set the microphone down, and hopefully everyone can hear me. So inside the training kit, there's this little card. It's a lot smaller than the actual ones that patients get, but I'm going to pass this around. So this is like one of the first things I always point out to the patient is to make sure that they look at this card, because I think it's super, super helpful. So I'll pass that around. And so the first thing I always start with my patients is I talk to them about why they're on the medication. I talk to them about how effective it is with lowering our bad cholesterol. I discuss with them the adverse effects that I went over, the postnasal drip and injection site reaction. With injection site reaction, I just kind of mentioned that if they experience it, it's just like might be a little bit red, that if it should go away within 24 or 48 hours. If it doesn't, or if it continues to grow, then that's when they want to seek help or seek medical treatment. And then I also discuss the patient's current med profile. And like I said, there's really not any drug interactions that we worry about, but it's still something that we discuss. And then I pull out that card for the patient, and I talk to them about the areas that they can administer the medication. And so it's your abdomen, staying away from your belly button, the tops of your thighs, and then it's the back of your arm. I generally tell my patients that that's a hard area to do unless someone's giving the injection for you. Another important point, and a lot of you probably heard about this, especially with diabetics, is that they want to make sure that they rotate the injection site. So if they only want to do their abdomen, that's fine. They just want to move it around. If they want to do the abdomen and their top of their thigh, they just want to make sure they rotate their site. So that's the first thing that I talk to them about, is the medication itself, and then where to administer the medication. And then I take out my demo pen and to explain to them that it looks just like the pen that they have. And so the first thing that they want to do, so this medication, Praluent and Repatha, they're both refrigerated. We don't want it in the freezer, but in the refrigerator. About 30 minutes before they're due for their injection, or before they want to take their medication, they want to take it out of the fridge and let it come to room temperature. You want it to be a normal process though, like we don't want them using a blow dryer to try and warm it up or anything like that. And the reason why we have them pull it out of the fridge is so that the injection just hurts less. So I don't know, with giving vaccines or receiving them, if the medication comes right out of the fridge, it stings a little bit more. So that's the reason why we ask them to pull it out of the fridge. So the first thing they do is they leave it sit out of the fridge for 30 minutes, and then they want to make sure that they have everything they need, which I showed you that slide previously. So they'll need their medication. Want to make sure that they have some type of disposal for their sharps, so whether it's a Gatorade bottle or sharps container. an alcohol swab, and then just have a Band-Aid readily available. Most of my patients don't really bleed at all, so but we just want to make sure they have that. Then the next thing that we ask them to do is to look at the medication window. So Repatha and Praluent are both mostly clear with maybe just a little bit of a yellow tint to it if you were to hold it up to something white. There is an air bubble in the medication, but that is okay. And so what they want to look for is that the discoloration isn't way off, or that there's not any particles floating around. And then the next thing they want to do is they want to swab the area they're going to administer their injection. And so we also want that alcohol to dry, so I tell them to swab themselves and then wait about 10 seconds. And there again, that's just a factor that could make the medication sting, is if that alcohol is still sitting there. So they've observed they've had it out for 30 minutes, they've observed the window, they've swabbed themselves, and then they take off this cap when they're ready to administer. I think it says on that card if it's off more than 5 minutes, it could do something to the medication. But then also once this cap is off, there's more chance that the medication could be administered without being ready. So they go ahead and take the cap off, and it goes in the trash. So their pen actually would just look like a little cap like this. This has a long piece for the actual demo pen, but they'll go ahead and take the cap off, and they will dispose of the cap. And then I like to tell my patients to hold the pen like this, and that is so that they can make sure they can see the window when they're administering the medication, and they have better control as well. So this safety device I showed you in the last picture, I like to think of it as a nail gun or a hand stapler. So with nail guns, most of them will not put a nail out unless the safety device is clicked in. So this is kind of very similar to a nail gun. So the next thing the patient will do when they're ready is they'll place the pen up to the place they're going to administer, and then they'll push down on the safety device. And all that is doing is making sure the injection's ready. It doesn't dispense the needle at that time. So they'll push against their skin, and then they're going to push the administer button. They want to push and hold. The reason why we want them to hold the button is because it helps keep the pen from moving around. Because if they push it and let go, there's more chance the pen can move around. And they'll hear a click with the needle, and the medication are starting to be administered. And then there'll be a yellow plunger that goes down. That's also showing the medication's being administered. And then you'll hear another click that the injection's done. So that's why, as far as holding the pen this way, it helps you hold the start button down, and then also being able to see the window to see the medication administered. It's about 15 seconds. So they're gonna put the, push the safety device, and then you hear your first click, and you can see your yellow window that your medication is being administered, and then you'll hear another click that the injection's done, and then this whole pen goes in your sharps container. Does anyone have any questions over the demo I just did? Yes?
Is that system similar to like long-acting insulin pens that we have? Are they?
I'd say it's similar in like the migraine medications. Yeah. It's similar as well. Yes. Yes.
Well, first of all, a comment. I loved your how you said that you could put, instead of the sharps, you can put it in a bottle and dispose of it that way. That's really a good tip. But have you tracked compliance at all? Is there any type of non-compliance due to pain of the injection?
Not non-compliance, but I actually just had a patient last week, was confused onto why, came in very confused and very frustrated, not knowing why the medication was prescribed, but I really think the frustration was the nerves of the injection. Like, came in for an injection training appointment and wasn't sure. Part of it was a little bit of confusion, which I helped clear up and clarify some things, but I think a bigger half of it was just the nervousness of the injection. And that's why, like, it's nice too to have the pens instead of syringes. I think it helps ease that because they are so easy. So yeah, as far as compliance is the pain, no, I haven't had any of that. Yes?
Just one more. I really don't know, why would anyone give themselves an injection in their stomach?
I know. When I train, I always just do my, so someone said they wanted to do their stomach because their legs already always hurt. And then another said that they feel like they have more muscle in their thighs and they think the injection would hurt less in their abdomen. So those are the couple reasons. But I would think for dexterity wise, when I train my patients, I always just do my thigh because I think it's easier dexterity wise and sitting and whatnot. But the majority of them do their abdomens. So, yeah. Okay, so like I said, one of the reasons why I wanted to go through this is not only that my hopes that down the road this is be something that you guys will be able to get into because like Dr. Sullivan said, there are some diabetes medications that are pre-filled syringes, just a little bit different things you have to do with those, but the migraine meds are, so there are many medications out there that are in the pre-filled syringes. But then also, if you have a patient call in and say, I'm trying to give my Praluent and it's not clicking, can anyone give me a guess as to why it's not clicking?
Can it push down?
Yes. Yep. So that's the big thing there, is that they don't, so it won't administer the medication unless our safety device is clicked there. Another question that I got from patients, and it even happened to one when I was training one, is that they heard the first click, you saw the window, they didn't hear the second click. So the second click, or even the first click, but the second click can be very quiet. So what I tell my patients is that, the medication window still went, and then aside from that, if they didn't hear the second click, we wouldn't tell them to give another dose anyway, because we don't know what amount of medication was administered. So those are just some things, hopefully now that you guys have kind of seen how it's used. If a patient calls in, you can feel comfortable taking some of those questions. Some other things that we run into are pin malfunctions, so pin malfunction, we direct patients to the website and then they contact them by phone number and say, my pin malfunctioned, it didn't, I did everything right, but the pin didn't work, and then they'll send out a replacement. One day I had a patient call and said that he had taken off the lid, which we don't want to do until we're ready to administer, but then had bumped, he must have been holding it like this, had bumped a counter, and so the safety device went, and he clicked the start button at the same time, and medication went everywhere. So the manufacturer's not going to cover that, but if you remember, it's given every other week, and we try and contact our patients 7 to 10 days before a refill. And so that patient was so far ahead with when his refills versus when his doses are due that I was able to bill his next refill through insurance. And so that's how I fixed that problem. Another way to look at that is that the 7-day window. So if you can't rebill it today to get it out to them, hopefully in 2 or 3 days, since there is so much time in between the administering of the medication, you'd be able to get them their next PIN. Let's see here. And then let's see. So now that yes.
I was just gonna, as far as the window goes, so let's say they decided that they're gonna do the first and the 15th, and like you said, you have that window of 7 days. So let's say that they did the first, but then they didn't bring over till the 17th, but you would still advise them the next time for the 15th.
Yep.
Or not skip to the 17th and go from there, so that it
Correct.
keeps going.
Yeah, so if they miss their dose and they administer it within 7 days, they stick with their normal dosing routine. If they are every other week and they get to day 10 of forgetting their dose, then I would have them go that day and then every 2 weeks from there. So if it's within the 7-day window that they missed their dose, then they can alternate, go back to their original dosing schedule. If it's beyond the 7 days, they'd want to go from there.
So would you consider, I know you said that you're hoping, in the future, that's something that possibly, we would be able to answer questions with and stuff. Do you feel like that's, borderline counseling to where we shouldn't be telling them, oh, you're okay to do it again on the first?
Right, right.
You just did it on the 17th because you
Right.
stay on your routine, or do you
So I think like right now at this point, our technicians direct those to us, you know, like what kind of, they do two different things. So if the patient is forthright about, oh, I was due 8 days ago and I forgot to give mine, that they would either like message us or forward it on to us. On the flip side, we do have some patients that, so we track when they gave their doses last month, when they're due, when they should be due again. And if they're out that way, then they'll put a little message in for us to contact the patient next time to just see what their dosing schedule looks like. So that's kind of answering part of your question, but then I think that a lot of the questions you guys had earlier too, it does go with like the more certification, the more schooling, and not just so that you guys get a better understanding of how it works, but then so you feel more comfortable answering those questions also. I even have some patients that I'll call and ask when their last dose was, when their next dose is due, and then so say they give it every other Tuesday. I was like, okay, so it sounds like you like to give it every other Tuesday. They're like, yeah, Monday or Tuesday or Wednesday, but they're still like kind of in that window. So I just, you know, I'm good with that. But then I also had a patient that came in, it's like, oh, I like to go camping. What if I am due, she wanted to do hers on the 1st and the 15th. I like to go camping and we don't have a refrigerator. And I'm like, okay, well, when do you go camping? Is it like a weekend? Is it a whole week? Well, just for the weekend. Like, okay, well, if you're due, the 15th is a Saturday, just wait till you get home and give it on Monday. It's just a couple days after. Then you can still stick with the 1st and the 15th. I have a lot of patients that call in and say that they're going on a cruise for 10 days and they're due for their dose within that time. Another really good thing about these medications is that they're good for 30 days outside of the refrigerator. So what I do is if they have a box of pens, I take one pen, you know, bring it with you on the plane in your purse, and it's good for 30 days. Because if they're giving it every other week or once a month or on the 1st and the 15th, they'll administer it within the 30 days. So they're good. You know, I still tell them, just like any other oral medications, that you don't want to put it in your purse and leave it in the car while you run in, you know, here or there while you're on vacation. So that's the other good thing about the medication though. And then also, say they go to give their dose today and they set it out at 8 o'clock to administer at 8:30 and it's noon, or it's in the afternoon or the evening, they're like, I forgot to give it. I'm like, go ahead and administer it. You don't want to put it back in the fridge, it's good for 30 days. Another thing that I like to do, or you guys, if you guys set up injection training, is when I call them, I'll ask them, are you going to run errands when you leave? And if they say yes, or if they have a long drive back home, I recommend that they bring like a lunch box with an ice pack. For those, you know, that aren't asked that, when I end my meeting, I'm like, are you going right home or do you have errands to run? They're like, oh, we'll be home in a couple hours. I go get them a cooler and an ice pack just so it stays refrigerated. Yes, Fred?
How many doses do you dispense at a time?
So 2. So a month's supply, there's 2 pens. This one only has 1, but their box comes with 2 pens in it. And so I do have one patient that only does 1 pen a month. And that's another question that I got once from a patient that was starting it, or no, patient was switching from, so Praluent and Repatha, insurance likes to jump from one to the other with their favorite or their preferred. And I had a patient that was on Repatha, which is the 140 milligrams, and insurance wanted them on Praluent, which was 75 milligrams. And so they were asking, well, is it not going to work as well? And so they're both as effective, but a way that I kind of explain that to the patient is, say you have 2 blood pressure medications. You have lisinopril 10 milligrams and metoprolol 50 milligrams. They both work, and the doses is just what the manufacturer set. It doesn't say that one works stronger than the other. So that was another thing that I kind of wanted to give your guys' my point of view of how I explain it to the patient, in case you guys come across that and that's something that you and your pharmacist feel comfortable with you talking to the patient. So what I just went over was injection training that we give to our patients when they first start their medication. So I do the training, I let them practice with the pen, and then they administer their first dose. Then they stick with us for about 15 minutes. So going forward, we, like I said, reach out to our patients about 7 to 10 days before they're due for a refill. And the first refill, a pharmacist reaches out, and then after that it goes to tech calls and then a pharmacist call, unless they have new health conditions, they're having troubles, or if they just don't seem like they're being compliant. So what we do for our workflow is we run the script, and this is just to make sure there's not any prior authorizations that are needed, because if there are, hopefully we're running it 10 days early and we can get the prior authorization done before they need their next dose, and to make sure there's not any other changes with their copay. And then the next thing I do is we have access to their charts, so we just make sure that they're not hospitalized. I check to see if there's any recent physician or cardiologist visits, or notes or messages between the patient and the nursing staff. If the patient's hospitalized, I'm not going to reach out to them. If they started the medication and they had adverse reactions and they had called into the doctor and they told them to hold it, I'm not going to reach out to them. I'll just follow them to see if they decide to re-challenge the patient. And then I read the notes that we put in last time, either from the last refill or the first fill. So I always look at when their last dose was, so I have an idea of when their next dose is due to know if they're compliant. I look to see if they had any questions with their last fill. And then I reach out to the patient and I set up delivery. And so this might kind of tie in a little bit with your question too. So the counseling questions that we always want to ask as pharmacists and technicians is, when is your next dose due? And that way we can compare it to what they said last month or what they did last month. Did you have any troubles with your previous injections? Or if you have a new patient starting in your counseling, you can ask them if they've ever injected any other medications. And then any changes in your medications, allergies, or health conditions is another question we want to always ask. And then what supplies do we need today? Like I explained to you earlier, we want to make sure that they're set up for success and that they have a way to dispose of their syringe, and they have alcohol swabs, and they have Band-Aids. So just a little recap, PCSK9 inhibitors are prescribed to lower bad cholesterol. Praluent and Repatha are self-administered sub-Q injections, and pharmacy personnel are a great resource in setting up patients for success with their PCSK9 injections. Do we have any other questions today? Yes?
Do you have any idea what the cost is?
So I think like out-of-pocket cost is a few $100s. Most of our patients, they are either on the coupon cards, so like $5, or they're set up with the grants. Otherwise, copay-wise, I think maybe the highest I've seen is around $40. And one thing I was going to kind of bring up, but I'm kind of hesitant because I don't know a ton about it, is that with our migraine meds, we started running into it, and I guess it's coming with PCSK9s like the Repatha and the Praluent and the coupon cards. And it has to do with insurance, but we've had patients that are using the coupon card, and it's $5, $5, $5, and then all of a sudden the copay goes up. I don't know if any of you have seen that, but it has to do with insurance and your deductible and your coupon code. So we are working on a way to track that. We know that other pharmacies tell their patients about it up front and tell them to keep track of it. We like to be more proactive and work for our patients. So we're trying to come up with ways to track that ourselves so that we can tell them, next month your copay will likely be higher, just to kind of give them a heads up. So, but other than that, I would say that most of our patients are on grant funding, either the HealthFlow grant or grant that's set up through the hospital for a $0 copay. A chunk of them have like a $5, $10, $15 copay, and then a few of them might have a $40 copay. Yes?
How many mils are in the syringe?
I think it's 0.5.
So
Remember for sure.
When it takes 15 seconds to deliver it, make it feel like there's more med.
Yes. Especially when you're sitting there watching them give their first injection and you know they're nervous, it always seems like longer than what it is. So, yes. Yes?
Thank you for a great presentation. I hope I can get Steve and me out of this as well. I need to learn about this. These are new meds. Couple comments. One thing I know is these are amazing medications. Number one, it's the LDL lowering is unprecedented. All we have right now is statin drugs. The So these drugs to come out, and it's great for medicine. You do have to have a certain patient type. You can't just do it for anybody with high cholesterol. So we have heart disease or familial hypercholesterol. We need like an LDL over 200. But these meds are really, really good. Cardiologists want to put them in the water.
Yep.
Just to lower. And from my perspective, when they first came out, I had a very difficult time getting them covered from primary care. So I usually send people to a cardiologist, and then they're the one. So that's probably most of your prescriptions are probably from cardiologists
Yep.
and the pharmacy. But now that trend is getting better. I've been able to get a few of these prescriptions covered. But the LDL lowering is just ridiculous. It's amazing.
Yep, and I even have patients that are excited. I'll call them and ask how their injection's going, and they'll say, I can handle it for what it's done, or they'll say, oh, you're probably calling for my gold, aren't you? And even the patients are excited about it because they see a change in their cholesterol, and they even see it quick.
Sorry, one more question back. Sorry, I remembered I wanted to ask earlier. So they start the medication, and then do they get labs drawn like a month later to see if there's a difference, or how long do they wait to see what the difference is?
I think it depends on provider. So when I saw the patient that was nervous a week ago, her next appointment was in July. And so she was just going to have hers drawn then. What we watch for is we want to see at least a yearly lipid panel for two reasons: to make sure it's working, the medication's working. If you don't see a change in the lipid panel, it's more than likely non-compliance. Or there's been only one patient that I've had that stopped the medication because they were compliant, but they did not see a change in their lipid profile, and their cost was on the higher end. And then I would say probably providers maybe 3 months after starting, if they don't already have an appointment scheduled. Yeah.
So when the patient is self-injecting, are they standing up or sitting down? Like are they doing it in their body?
Right, sitting down both ways kind of helps. It helps dexterity-wise, I think comfort-wise, and then also for safety reasons too, so that they don't, if they happen to pass out or something like that. But yeah, they're always sitting with me, and then I would instruct them to sit as well. Yeah.
Hello, and welcome to the Proluent instructional video, where we show you how to use your Proluent pre-filled pen. Before using your pen, read the entire instructions for use found in your Proluent package, and watch this video to make yourself familiar with each step. Those instructions, along with this video, provide fully detailed information about each step for treating yourself with Proluent. Use the Proluent pre-filled pen as directed by your healthcare provider. The steps for treating yourself with Proluent are the same for both the 75 mg and 150 mg dosage strengths. But in this video, we will show you how to use the 75 mg pen. You should start with the dose prescribed by your healthcare provider. Proluent is a self-administered injection from the pre-filled pen that you see here. The pen includes a blue cap, a yellow safety cover, an inspection window, and a green button. To prepare, take the pen out of your refrigerator. First, look at the label on the pen. Then check to see that you have the correct dose. Green 75 mg for this pen, and check the use-by date. Then, look at the window and check that the liquid is clear, colorless to pale yellow and free from particles. Do not use if the window appears to be solid yellow. It is okay if you see an air bubble, but do not use the pen if it has been dropped or damaged. Now, let the pen come to room temperature for 30 to 40 minutes. Do not heat the pen. Let it warm up on its own. Also, do not put the pen back in the refrigerator. If you have any questions as to whether or not the pen is okay to use, please call 1-844-PROLUENT. When you're ready, gather alcohol wipes and cotton balls or gauze pads. Please make sure to have a puncture-resistant container available to put your Proluent pen into once you've finished. Ask your healthcare provider about the proper way to dispose of your used pens. Call 1-844-PROLUENT to request an appropriate puncture-resistant container. Next, wash your hands with soap and water and dry them well. Then take your pen and supplies to a comfortable, well-lit room where you feel relaxed. Sitting or standing is okay. Now, choose where you'd like to inject Proluent. You can inject Proluent in your thighs, stomach, except for the 2-inch area around your navel, or your upper arms. Do not use Proluent on skin that is injured, tender, hard, red, or hot. Don't use the pen in areas where you have visible veins, scars, or stretch marks. Try and rotate the injection site each time, but do not use the exact same spot as you used for your last injection. Once you have chosen the area where you'd like to inject Proluent, wipe it with an alcohol swab and then let dry. Now you're ready to use your pen. Hold the pen in the middle with one hand. With your other hand, pull the blue cap straight off the pen. Do not twist it off. Once you have taken off the cap, do not put it back on. It should be placed in the puncture-resistant container. Also, be careful not to touch the yellow safety cover. Hold the pen like this in the palm of your hand in an upright position so that you can clearly see the window. Place the pen straight against your skin at a 90-degree angle and firmly press it into the site until you cannot see the yellow safety cover anymore. The pen won't work if the yellow safety cover is not fully depressed. If needed, pinch the skin to make sure the injection site is firm. Next, you're going to push and immediately release the green button with your thumb. You'll hear a click, which lets you know the medicine is being delivered. Keep holding the pen against your skin after releasing the button. The injection may take up to 20 seconds. Watch the window, you will see the yellow marker moving as the medicine is being delivered. When the entire window has turned yellow, the injection is finished. You may also hear a second click. This may take up to 20 seconds. If the window does not turn completely yellow, call 1-844-PROLUENT for help. Do not give yourself a second dose without speaking to your healthcare provider. As a reminder, if you didn't immediately release the button, you will not hear a second click as the dosing window turns completely yellow. Don't worry, the medicine has still been delivered. When the window turns completely yellow, you're finished with the injection and can pull the pen away from your skin. Now that you've finished, you may see a little bleeding. Don't worry, just hold a cotton ball or gauze pad over the site until any bleeding stops. Do not rub the area where you've injected Proluent. Be sure to put the used pen in an FDA-cleared sharps disposal container right after use, and keep it out of the reach of children. If you do not have an FDA-cleared sharps disposal container, you can use a puncture-resistant household container. Follow your local guidelines and ask your healthcare provider for the appropriate way to dispose of the container once it is full. Remember to keep the Proluent pen and all medications out of the reach of children. Use the Proluent pen once only and then dispose of it properly.
What is Proluent? Alirocumab. Proluent is an injectable prescription medicine used in adults with cardiovascular disease to reduce the risk of heart attack, stroke, and certain types of chest pain conditions, unstable angina, requiring hospitalization, along with diet, alone, or together with other cholesterol-lowering medicines in adults with high blood cholesterol levels called primary hyperlipidemia, including a type of high cholesterol called heterozygous familial hypercholesterolemia, to reduce low-density lipoprotein cholesterol, LDLC, or bad cholesterol, along with other LDL-lowering treatments in adults with a type of high cholesterol called homozygous familial hypercholesterolemia, who need additional lowering of LDLC. It is not known if Proluent is safe and effective in children. Important safety information. Do not use Proluent if you are allergic to alirocumab, or to any of the ingredients in Praluent. Before you start using Praluent, tell your healthcare provider about all of your medical conditions, including allergies, and if you are pregnant or plan to become pregnant, or if you are breastfeeding or plan to breastfeed. Tell your healthcare provider or pharmacist about any medicines you take, including prescription and over-the-counter medicines, vitamins, or herbal supplements. Praluent can cause serious side effects, including allergic reactions that can be severe and require treatment in a hospital. Stop using Praluent and call your healthcare provider or go to the nearest hospital emergency room right away if you have any symptoms of an allergic reaction, including a severe rash, redness, hives, severe itching, trouble breathing, or swelling of the face, lips, throat, or tongue. The most common side effects of Praluent include redness, itching, swelling, or pain, tenderness at the injection site, symptoms of the common cold, and flu or flu-like symptoms. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Talk to your doctor about the right way to prepare and give yourself a Praluent injection, and follow the instructions for use that comes with Praluent. You may report side effects to the FDA at 1-800-FDA-1088. Please see accompanying full prescribing information provided below. You can also visit www.praluent.com to learn more and for the full prescribing information for Praluent alirocumab.